So in this video, we're going to talk medication. So you hear me use the words Thorazine, Seroquel, a generic for Thorazine, Haldol. You heard me say Lamictal. My nipples were dripping milk from the Risperidone. You got all these other things like Xanax and Ritalin. Well, the Thorazine started when I was real young in some of the hospitals. If you're wondering how the Thorazine got in my body, when I was age about 11 to 12 and I was getting hospitalized, they started injecting me against my will with Haldol and Thorazine. On top of that, when I came out, they gave a prescription to my mother to continue. Now that went away, but then my mother told me I needed these medications and told me to ask for a lot of these medications and just repeat basically, I am disabled in these ways. I'm bipolar. I am depressed. I'm just simple phrases like that. And then also before, this is when I'm 16, 17, after being brainwashed, after going through all this and not knowing what it means. What does it mean for a mother to give you a whole bottle of Ipecac and destroy your stomach and esophagus? According to my mother, it means nothing. It's just a normal punishment, and I have nothing wrong with my stomach or esophagus. I'm just anorexic, is what she was telling the doctors. I must be anorexic. I must be anorexic, is what she kept on. Oh, I look anorexic. Well, you know why? You're poisoning your child with Ipecac, overdoses, medications. That's why your child that you just adopted already has one traumatic memory of being held down in the orphanage. Now you have literally given him an overdose of medication, a bottle of Ipecac, and there are many, many, many pills involved which she's messing around with. That's what gave me the overdoses. She was messing around with some pills. She used to brag to her friends in the kitchen. This is when I was 5 in Westford. Used to bring her nurse friends or her teacher friends in there and say, look at all the meds I have to give my child. My child's so sick. And I used to have to take them dry, too. One of her friends tried to tell her, you really should have him take that with a glass of water. You know what my mother said? Oh, no, he does this all the time. He's fine. Let him take it dry. Now, I continued taking my medicine in Westford dry at the age of 5 to 7 until one day a pill got stuck in my throat and started burning the fuck out of me. Once when it burned my esophagus a little bit by that pill, I started using water and liquids to put it down. But my mother didn't help me with that. No, he always takes it dry. Let him do it. But the problem is I didn't need any of those medications. I shouldn't have been taking them dry or with liquids. Literally, after an overdose, you shouldn't be taking medications. Not just that, I'm speaking up at the doctor's office and my mother's calling in an allergy attack and then telling me to shut the fuck up without the fuck in there. But basically, that's her attitude. Shut up about it. Don't talk about it. It's an allergy. It's over with. Don't talk about it. Your son can't move his body. The teachers are realizing something is wrong. Before the overdose, when I went to school, they just normally did stuff. But after the overdose, one day in class, the teacher stopped the class, grabbed me, talked to me in the hallway and said, it looks like you're having trouble speaking and moving your body all of a sudden. Is there something wrong? I go, no. And then she calls home. And then I had to go to physical therapy and speech therapy. This was right after the overdose. Then my mother decides to take me out of any doctors, any neurology or anything like that. And she decides to put me in ballet. And she starts going the psych way with this. She starts making it into a psychological case. On top of that, then she moves me halfway across the world as this is going on. We move from Massachusetts to El Paso, Texas. Then she moves me from El Paso, Texas to New Mexico. Then she moves me to New Mexico to Maine. Of course, I'm not doing so well. So when you hear these medications, keep in mind they go back a long time. But Thorazine started with being forced into me in a hospital. Then my mother had a small temporary prescription, and then she pushed me to get more of these prescriptions over time. Now, to remind you, she only pushed me to get the prescriptions when I was like 16 and starting to become a teenager. Before that, she just lied, manipulated, confused me, brainwashed me, drugged me, did whatever she felt was necessary. She even tried to convince me I was schizophrenic and doctor shop to get schizophrenic medication. I'm not kidding. My mother, multiple times, all the way back to age 10 and 11, was telling people I was schizophrenic and needed schizophrenic drugs. The doctors told her very clearly that that's not the case. Everybody told her to stop with that shit. But she continued. She continued to affect my health and try to brainwash me into thinking I'm schizophrenic and I need the medications. She also continued doctor shopping and trying to get doctors to give her schizophrenic medication to give to me, after being told multiple times that that's a bad idea. She used to do this stuff quite often, where she would give me some really fucked up treatment, some really fucked up pills, destroy my health, and then make it into a mental illness. Well, now I'm 31 and I need real help after 25 years of this shit. I can't treat myself. I can't drive. I can't walk. I can't move my body properly. It seems like the doctors aren't going to help me because they're feeding into my mother's fantasies whenever I go down. And on top of that, the Department of Health and Human Services is very, very, very good at holding their money to themselves and refusing care to anybody that seems mental. Anybody with even one little drop of mental health stuff on their record. Oh yeah, you're getting fucked with good. These mental people get fucked with. You should see how when they go to the hospital, oh my God. Some of these people are literally just chopped up into pieces and malpracticed on purpose so they don't come back. And me, I'm just going there because I have something really wrong with me, a broken leg, my urine turned black, there's blood in my testicles. This isn't stuff I want to see. It's scaring me. Then I go to the hospital and they try to chop me up in pieces instead of actually trying to treat me. And that's to make sure I don't come back. And I don't like that. Now, I shouldn't say literally chop me up in the pieces. What I mean by that, if you ever hear me use the phrase chop me up in the pieces, I mean malpractice me in some way. Because doctors purposely malpractice the mentally disabled and the mentally disturbed so they won't come back. I've seen this hundreds of times in Lowell. I've seen it up here. It's a very common practice. Well, I'm not going in because I'm mental. I'm going in because a crazy mental person didn't get treatment and hurt a child. Now that child has physical health issues and he needs help. That's why I'm going to the doctors, but they don't care. They don't care. They don't listen. They don't listen to a goddamn word you tell them. You tell them that you have a broken leg and they're checking you for mental illnesses. You tell them that your urine's turning black and they think that you're messing around with your urine cup. They don't listen. The patient has told you what is wrong. But instead of looking into what is wrong, you guys are treating it like a mental illness and releasing the patient. That's fucked up shit, and it's due to my mother doing this for years and years and years. They have no idea what's going on with me. When I go in and I have black urine, the doctor's like, does he really have black urine? Or is this some mental illness? Is he just wanting people to look at his dick and balls? So then he looks into my file, sees everything my mother said for 15 years, closes the file, and instead of even using his own eyeballs to check it, instead of having me do a urine sample and going by that, what I did, I literally demand a urine sample, demand one, so that I can pee in front of them and they can see the black go in the cup, which they did see at the emergency room. They had one on camera coming out of me, and they had the original one that's probably no good. But see, they don't want to look at that. As soon as they look at my file, they make all their decisions right then and there, before they even speak with me. As soon as they get my name, as soon as they look up my name, everything is out the window. Doesn't matter what's really wrong with me. As soon as they look up my name and read my mother's bullshit fantasy, I get refused care. And that's what has been happening for 25 years. That's why I'm dying. There's no other reason. There's nothing wrong with me where I have to die, except for I'm not getting medical care. That's it. After 25 years of not getting medical care with a severe illness like mine, yes, you get really hurt. I had a car run over my hair just a couple years ago. I'm lucky to be alive for that one. I froze on the side of the road for 2 days. I also froze out on the Riverwalk for a day or two. I was pronounced dead on arrival, I guess they told me, and they had to get me back breathing, and it was a big thing. So I've almost died from this several times, and I know that if I lose this apartment, that's it. That's the last. There is no way I live through this if I don't have a warm place to stop the seizures from hitting. If I don't have some medical base to call the doctors and work this out. If I don't have that, then there's no chance of me staying alive. And that's based on facts. That's based off of what's happened before. There's no doubt in my mind because we've already tried this 140 times over, and every single time we know what happens. If you do the same thing over and over and over and over, and you're expecting different results, That's insanity. Now, I'm not insane. So I know what happens if I try to live outdoors. I know what happens if I try to live in a shelter. I know what happens if I go without medical care. We've done that over and over and over and over. What happens is I either almost die, I get run over, I get left in the cold for 2 days, and then I wake up in the emergency room. I wake up in the emergency room all cut up. Somebody robs my ID, somebody steals me, kicks me, beats me. The cops think I'm making up a story. The shelters throw me out, whatever. We have already done this 100 times over. Now, if we go back to my childhood, we did this then too. We had me try to go see fireworks, I fell down. We had me on a beach, I couldn't walk. We had me try to ride bikes during the cold, I fell. When I tried to play tennis barefoot, I could play with my skin removed. We have tried this for years and years and years. We know what happens if I don't take in consideration my disabilities. So, what should I do about this? Well, I have to continue trying with the doctors. I have to continue talking to my family. I have to continue asking for help. But now I'm out of work and I can't go back to work until the doctors help me. There's no way I can go back to work. I am now fucked up beyond belief. My body is gone. My intestines, my kidneys, my nervous system, my speech, my movement of my arms and legs, all of it just fucked. Even if I get the kidney pain reduced, what I think is getting better, even if the GI pain goes down to a 2, when I try to walk outside, I'm still going to have trouble. I'm still going to fall. I still have a 25-year-old disability that's still not being treated or documented. So I'm just screwed. I'm royally screwed. And I know this for sure because I'm not insane. If you do the same thing over and over and over and over and over and over, and you expect different results, now that's insane. And I'm not doing the same thing over and over expecting different results. No fucking way. I've now gone to the doctors like 100 times and I see the problem. My mother's mental illness and all this mental bullshit is in the way. So instead of going to the doctors, we got to try to fix some of that. And then I tried to fix some of that. There's a problem there. We try, okay, I got a money problem too. We see that working. I've tried to work over and over and I love it. But I get injured over and over. I work, I get injured. 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 Well, so if I go back to work, we know I'm going to get injured. If I thought I wasn't, I would be insane because we've already done this over and over and over and we've seen the results. I get injured severely. So I got to go to a doctor, get my diagnosis, and then I go right back to work where I love it. Because these houses and these apartments are deadly, disgusting. Who the hell would want to stay in this apartment? No. I love my job. I love being able to run a business by myself. I'm great with the customers. I got lots of old people I talk to during the day, and everybody tells me how good I do compared to the rest of the workforce. Oh, you're so kind. You're always trying to do better. You're always, if we made a complaint like that at any other place, they would tell me to go someplace else. You actually make an attempt to try to fix my problem. Of course I do. That's my job. You're telling me if you came in here with a complaint, they tell you to get lost? Yep. Oh, that's wrong. That's wrong. But see, I'm a different person. I'll sit down in the chair and I'll go on the phone and I'll try to get management, take it up, take your receipt, pass it up the chain, give you a day to come back, then tell you what's happening on the next day. I work really hard to give the best service possible, but also I work really hard to help people in general. But I can't do that while on the floor, not able to stretch. And this is what happens. I do really good at work, but then my disability gets me hurt either on the way to work, on the way home to work, or if the heat's out or whatever. We have serious problems at work. I've even had to bring in heaters to make sure I don't fall because we lost heat. So I had to bring in 3 heaters and surround myself so I could continue my job thanks to my disability. This is serious shit. And I still don't have any documentation after 25 years. I mean, goddamn, they keep on going into my mother's fantasy land. She's no longer alive. I mean, the way that her death was totally messed up too. I wasn't allowed to visit her. I wasn't allowed to see and collect my inheritance. I wasn't allowed to even talk to her during her death. The only time I saw her during her 4 months of death was the one night she came home and drank in front of me. That's it. On top of this, then my father literally just covers up everything that happened. The drinking right beforehand, the drinking right when she came home, the freaking pills going missing, the Vicodin going, literally she took my Vicodin from the cabinet. Those medications I was on were hurting me so bad that I was rushed to the I was rushed to the hospital, the ER, because I'm on the floor with severe headaches. Those continued from. I had severe headaches a lot of the time from those medications. Luckily, as soon as I stopped taking drugs, as soon as I stopped letting the doctors and my mother drug me heavily with Thorazine and Seroquel and Trazodone and Lamictal and Risperidone and Remeron and all these other ones. Now, as an adult, it's my own fault for believing in it. I was told that I needed these drugs for life. Oh, you need these medicines for life. You need these medicines for life. You need them. You can't live without them, is what I was told. I was brainwashed into thinking I need all these drugs. Meanwhile, as soon as I stop taking them, I can talk. I can do better. I still have to fix the nervous system issue. I still have to deal with the PTSD of what my mother did with me. I still have to deal with the damage of all these pills that my mother was messing around with. And those are regular doses. Don't forget, my mother doubled them up. She gave me full bottles of Epicac, and she gave me a full-blown overdose at age 7, which my body was fried and my mind was fried from. Oh my God. It was by far one of the worst things. It is. Yeah, it is the worst thing that's ever happened to me in my life is my mother literally ODing me and then leaving me to die on a pile of newspapers. And then I wake up with my body different for the rest of my life. That is by far the most traumatic thing I think that's happened in my life. I mean, even the people trying to hold me at knife point, even the people throwing me to the ground and beating me half to death in the woods. I still think what my mother did to me is more traumatic. It still sticks with me a lot harder, especially that I feel it every day of my life. Every day of my life, I feel what my mother did to me. There was a big change, and you could feel that change. One day, I'm normal, about to watch Batman. The next day, my whole body is different for the rest of my life. And I can feel this difference for the rest of my life. And no matter how many times I go to primary cares or doctors, they just want to feed into my mother's fantasy. Even though there's visual proof, my mother admitted to it. This isn't like an argument either. My mother said that yes, something happened, and she called it an allergy attack. It's not an allergy attack. Even the doctors at the time said that was impossible. They told her that was impossible right on the phone and to have her bring me in the ER ambulance or bring me right to the hospital. She refused. It's very obvious. I mean, why, if your kid's having an allergy attack, his breathing is slowing down, his chest is out of control, he can't talk, he lost his speech, he can't walk, he can't feel his body, his breathing slowing down, and he goes unconscious. Would you leave your child on a pile of newspapers on that condition, or would you bring him to an ER? You bring him to an ER, stupid. My mother knew she did something wrong, so she left me to die, hoping I wouldn't die. Then when I woke up, and something was seriously wrong with me, and I'm telling doctors about it, she took evasive action and started covering up her actions. And now I have to give up a lot of my life. And I also have to hear pricks go, well, it must be your own fault. That's my father and his new wife speaking, by the way. They always like to come up with lines that allow them to go vacation. I'm not even kidding. So while I was like 12 years old, right? And I was in need of care or in need of stuff, my father and mother used to take like month cruises. Or for instance, while I was getting abused in New Mexico, they only got to see me about 1 hour a month. That's it, 1 hour a month. And this always made them happy. My family is very happy to be on a beach getting drunk. Meanwhile, I'm getting kicked around and getting drugged and horrible things. And when I tell them about it with pictures or evidence, they don't want to hear it. They make up some fantasy story that allows them to continue. Or, oh, I forgot. I don't remember. Or stuff like that. That's great if you don't remember. That's fine. But then you need to speak to me, and I'll tell you what happened. And that's the problem. It doesn't matter. There's witnesses. For instance, my father, my sister's husband, and me, and my mother were all in the kitchen and living room. They asked me why I'm always so upset at my mother. I told them, well, if she would stop drugging me with full bottles of Epicac and doing horrible psychotic shit, then I wouldn't be upset at her. And then I said, what are you going to do now, Mom? Are you going to lie like you usually do and tell everybody you never gave me a full bottle of Epicac? Are you going to tell everybody you never did that? And you know what my mother's response was in front of all these witnesses? Yeah, I gave you extra Epicac. I gave you a lot of Epicac as a punishment. So what? So what? What's the big deal? So what? I gave you extra medicine, is what my mother said in front of these witnesses. And then I responded with this. Anybody see a problem with this? My mother just said that she gave a child extra Epicac as a punishment. Does anybody think that that has a problem to it? And I'll state that question again. Does anybody think it's wrong or right for a mother to give a full bottle of Epicac or extra Epicac to a child as a punishment? Does anybody think that that is okay? Now, my father's response was, yeah, that's fine. I'm not even kidding. My sister and my sister's husband were horrified by this. They went, no. Then my father, I went back looking at him, and he goes, oh, what did I miss? I was in La La Land. What's going on? Why is my daughter and her husband saying, oh, no, something's wrong, and I'm over here saying, no, everything's right? I don't understand what's going on. Well, I'll explain it for you. This is what was going on there. I was suffering for many, many years getting drugged by this woman. I just admitted to it. She just admitted to a crime, drugging me with full bottles of Epicac. The sister and the husband are very, very smart, and they're aware that this is fucked up. But my father is in La La Land. This stuff has been going on in front of him